everyone. I am Ivy Zukaya. I am moderating this panel today. Our first panel is broadly focused on accessing services. So the folks we have joining us, the first presentation will be on county-level variations in transition-age youth's transitional independent living plan development and independent living service utilization. That is by Ethan Park, who is an assistant professor at the University of Michigan School of Social Work. And he is also an organizational scholar with an overarching research question of how can health and social service organizations provide more responsive and effective services. Our second presentation of this panel will be on exploring provider perspectives on county factors impacting utilization of transitional housing programs for non-minor dependents in California. This will be presented by Selena Liu Rafael, who serves as the lead policy analyst focused on transition-age youth at the Catalyst Center / California Alliance of Children and Family Services. Right. And then my paper will cut off. Beautiful. Then we will be hearing from Mirabel Rafael, who is a research assistant at the Catalyst Center. They will be co-presenters, I believe. And then for the third presentation, a case study of FUPY and FYI housing choice vouchers in Los Angeles. This will be documenting the experiences of young adults, property managers, and case managers. And we'll be hearing from Brenda Tully, who joins us from the UCLA Pritzker Center for Strengthening Children and Families. She is a research fellow there.
All right. Good morning. I'm Ethan Park, or Park Sung-gun. I'm an assistant professor at the University of Michigan School of Social Work. Nice to meet you. I've been actually working with Cal Youth and TAY-Hub for the past 10 years, and embarrassingly, this is my first time coming out and standing in front of you. I hope this is a first of many opportunities that we'll have in the future. So today, I'll talk about the transition-age youth experience with the transition independent living plan development and independent living service realization, and then how county-level context and factors associated with youth experience. This work was done in collaboration with Justin Hardy at Arizona State and Nate Alpich at UConn. I want to start today's talk with this memo that we published last year, summarizing about more than a dozen peer-reviewed articles and memos on how county-level factors are associated with youth experience and outcome. One of the main reasons why county contexts matter is because California has a decentralized child welfare system, which is a state-supervised, county-administered child welfare system. One of the core strengths of this decentralized system is that counties have significant discretions in how to organize and how to administer certain child welfare services to better accommodate the needs and concerns of the youth in their counties. But on the other hand, this decentralized system might be less effective in producing more consistent and effective outcomes because of the variations in the county context, like administrative capacity, or the strength of a civil society, availability of the services, or context of a political and economic circumstances. Our previous studies shows that youth time in extended foster care can vary up to 10 months based on their placement county, and youth employment, education outcomes, et cetera, are associated with county's administrative context, all summarized in this memo. With that background, I want to focus on two programs today, Transition Independent Living Plan and Independent Living Services. To better prepare transition-age youth for adulthood transition, multiple federal laws mandate co-producing Transition Independent Living Plan, or TILP, which is engaging youth in care decision-making processes to capture their goals and needs and wants, and then develop the individualized service plans. And multiple laws also fund independent living services that are intended to build skills that will help youth achieve self-sufficiencies in various domains: education, employment, budgeting, housing, relationship building, et cetera. So underlying theory here is that By co-producing this TILP, individualized service plan, we can identify the relevant and responsive services, so we can connect them to these services and allow them to develop these core independent living skills. Unfortunately, we know very little about the prevalence and patterns of this transition independent living plan development and independent living service in California. And there are very limited evidence, actually, showing the relationship between TILP development and independent living service utilization, and how these contextual factors, county administrative context, are associated with youth experiences. And here is where our study comes in. We first described the transition age youth TILP development and the independent living service utilization patterns in California. And then we examined how county level factors are associated with youth TILP development. And lastly, we explore how counties' child welfare administrative context and the TILP development are associated with independent living service utilization patterns. But eventually, after this study, we'll look into how these county level context, TILP development patterns, and the independent living service utilization experience are associated with youth outcomes, which is something we're looking forward to do. All right. So for this study, we used the California Child Welfare admin data and the data from the caseworker survey we conducted in 2015 and other publicly available data. From California Child Welfare data, we identified about 27,000 youth who stayed in care after 16th birthday, who turned 18 between 2014 and 2020, and who stayed in care for 12 months after their 17th, 18th, 19th, 20th birthday. So limiting our sample to these youth who stayed a full year after their birthday is very important for us to control for any biases coming from youth, including youth that spend different time in care. Like youth spending care for 3 months may have inherently little opportunities and chance to use independent living services or develop TILP compared to the youth who spend 10 months, 11 months, and 12 months. Our key factors include the number of TILP developed per year and the number of these services used per year. And we use the statistical analysis to examine how different factors are affecting or affect the TILP development and independent living service utilization after controlling for other factors effect. All right, let's look at the numbers here. So on average, youth developed about 1 TILP per year at ages 17, 18, 19, 20. By the way, CDSS recommends TILPs to be updated every 6 months, so we expected to see numbers closer to 2 here. And on average, youth used about 10 independent services at 17 and received about 7 to 8 services between 18 and 20. This decline in the number of services utilized is mainly driven by the number of service used relevant to the education, which is kind of distorted, but the green line represents that trend. While the employment-related service, which is orange line, is picking up, but not quite the level the education-related service once had at 17. We'll obviously conduct a follow-up study how these different different groups of service are used and what the impacts of these services or potentially bundles or package of different services will have on youth experiences and outcomes. When we look at the county level, the range of average number of TILP developed per year varied between 0 to 2, which means in some counties, an average youth developed close to 0 TILP per year. In other counties, an average youth developed about 2 transition independent living plan per year in these periods. There are also significant county level variations in the range of the average number of independent living service used per year. In some counties, an average youth received about 1 service per year at 17, 18, 19, 20. In other counties, an average youth received more than 20 services per year. At 17, they received about 27. And this table summarizes the factors associated with TILP development. There are a number of youth-level characteristics associated with youth TILP development, but this is not our focus today, and we'll have a chance to further explore in the future. So we found that youth placed in more politically conservative counties, more services available, and better collaboration between child welfare departments and other service systems developed more TILP. And youth in counties with higher unemployment rates and the LA County were likely to develop fewer transition independent living plans. In terms of the factors associated with youth use of independent living services, we found similarly many youth-level and county-level characteristics associations. For example, youth in counties with higher unemployment rates were likely to use more independent living services, and youth in LA County were expected to receive fewer independent living services compared to the youth placed in urban and large urban counties. But one of the main driver of a youth independent living service utilization frequency, probably one of the main driver was the number of TILP developed in the previous year across all the analysis that we conducted so far. Our study certainly comes with multiple limitations. Our admin data does not necessarily tell us whether these transition independent living plan reflects youth true wishes or wants. Our previous study shows that about a third of the youth didn't participate or didn't aware of their TILP existence at 17. And our admin data does not necessarily tell us also whether these independent living service these youth received are relevant to or reflect to the services documented or identified in the TILP. And independent living services can vary how it was administered, quality, dosage, based on the county and the context or availability of different services. And we seems to miss important factors that can be relevant to youth experiences, such as like a county level factors, such as county's priorities, what kind of services, or the trainings that caseworkers and other stakeholders received, et cetera. Finally, our findings may not be generalizable to other child welfare settings. Youth in states and counties with more centralized admin system and didn't extend the foster care age limit may have different experiences. But despite these limitations, our study offers really valuable discussions and the implications. Transitional independent living plan and independent living services has been core programs supporting youth adulthood transition in the past decades. And our study really shows that youth with documented transitional independent living plan seems to receive independent living services more frequently, which is not a surprising finding, but really assuring finding that TILP development seems to facilitate youth utilization of these services that can better equip youth with core independent living skills. And our study also highlights the importance of a county-level context by showing their relationships with the youth TILP development and independent living service relation patterns. And our study offers really important practice implications as well. First and foremost, our finding really encourages caseworkers to co-produce and update TILPs regularly. And our study encourages county administrators and supervisors to support the TILP practice and nurture the administrative context that can really facilitate the development of the TILP and the utilization of independent living services, such as forming collaborative relationships with other service sectors or fields. And our study also emphasized the importance of gathering qualitative and quantitative data that can really shed light on the county level context, such as the upcoming survey of representative sample of caseworkers in California. And we need to examine whether and how these youth TILP development and the independent living service make differences in youth outcomes. And lastly, studying how caseworkers use different approaches in developing transition independent living plan can be a very interesting and important study to do. Anecdotally, we know that caseworkers use various approaches when it comes to developing transition independent living plans. Some caseworkers may develop a TILP without consulting or without engaging youth on behalf of them. And other caseworkers may ask you to take the lead and then just provide the responsive services without really negotiating or putting much more kind of a comment or input. And the other group might really engage in a collaborative manner, like deliberatively coming up with a set of the plan that incorporates the expertise and knowledge of both youth and the caseworkers. And we may want to really know in what conditions, in what context, caseworkers use different approaches, and how they change their approaches as youth progress, as they build more trustful relationship, as some services become available, and what differences these approaches make in youth service experience and outcomes will be very important to study. But that's all I have. Thank you.
All right, so folks, if you have questions for Ethan, please go ahead and save those until we hear all three presentations, and then we'll have some times for that. And now I'll ask for colleagues Selena and Mirabel to join us.
Good morning, everyone. So Mirabel and I will be exploring the provider perspectives on the county factors. As Ethan mentioned, we have a decentralized system here in California, so we have state-by-state variation in utilization of transitional housing programs for transition-aged youth, and we'll be focused on non-minor dependents. I'm Selena Lou Raphael. I work for the California Alliance of Child and Family Services as the Senior Policy Analyst, and I've also been working under the Catalyst Center under the Thriving into Adulthood project, which is really centralized around transition-aged youth.
And I'm Mirabel Raphael, and I'm a research assistant for the Catalyst Center.
So just a little bit about us and why we were uniquely positioned to do this particular study. The California Alliance represents over 165 plus provider agencies. So we were interviewing and surveying not only our member agencies, but those that all who provide THPP NMD services across the state. And then because of our project with the Catalyst Center, with transition-aged youth, sometimes we, even though the youth weren't the focus of the study, we were looking from the provider perspective, there were many times we wanted to ask the youth to really just verify whether what we were finding was reflective of their experiences as well.
Okay, so the Transitional Housing Placement Program, THPP NMD, is one of the most commonly used placement options for youth in extended foster care in California, and it is a program which provides both housing and supportive services to help youth gain the independent skills to transition to independent living. And this is a fee-for-service program, meaning that providers are compensated based on the amount of time that youth actually spend in their program. One of the other most commonly used placement options is SILPs, or Supervised Independent Living Programs, and comparatively, this placement option involves less supervision, but still provides a stipend that youth are intended to use to secure their own housing. And overall, in California, THPP NMD has a lower utilization rate compared to SILP, but as you can see on the right here, some counties like San Francisco have a higher usage of THPP NMD, and this discrepancy is what we were attempting to explore with our study. Our methodology for the study was first beginning with a literature review of publicly available information, both public data, previous studies that have been conducted, et cetera, and then we moved on to 4 waves of surveys sent to THPP NMD providers across the state, and our surveys had a reach of 35 plus because some providers served multiple counties with their THPP NMD programs out of the 40 counties in California that have THPP NMD available, or that have their own programs rather. And then finally, we had some one-on-one interviews between Selena and individual providers, which attempted to provide additional clarity and answer any questions that we had remaining after getting results from our survey. And our overall goal with this survey was to get both quantitative and qualitative information about how THPP NMD programs from the provider perspective vary across the state.
So one of the first things we came across is really like, who are these programs intended to serve? As we mentioned, SILPs are lighter touch, less supervision, less support, and THPP NMDs have a varying wider range of support with staffing to really support the youth. But what we also found is that sometimes a youth is not determined to have the level of independence for SILPs, and then they get rejected from a THPP NMD, and then they come back to SILPs. So there were some questions about that, and then when we were looking at some contracts, one example would be San Diego's contract requires youth to have 40 hours of productivity, which means they're supposed to be working and in school for 40 hours, whereas in LA, they were looking at youth who had higher needs. And so it can be very confusing for youth when it's like, well, one county expects me to have this level, and then this county expects me to actually have more needs. And one of the youth that we did talk to, who was very instrumental in our actual Thriving into Adulthood project, she said, well, yes, I was actually more the San Diego youth. I was working and in school full time, and I got rejected twice from LA's THPP NMD program. And then I went on Reddit, and I looked up, how do I get into THPP NMD? And she said, I told them I was a chronic drug user and I had juvenile justice experience, and the very next day she got housing. So really, we're looking at who is this for? How is it confusing for youth? How do they access it? And really, from the provider perspective, who are each providers intended to serve? And there are variations across the state. So we felt like that was really important to note, because also providers have been looking at being asked to do assessments, and a Monterey provider said, well, we do assessments, but the assessments don't actually matter, because when housing is a critical resource for me to survive, I'm going to answer according to how I think I'm supposed to answer to get the service that I need. So what they said was, we accept everyone, and then we actually just serve the person in front of us. So they may say they know how to cook, they know how to handle their finances, but actually they don't. So we just serve whoever comes to us for whatever they need. So we did want to mention that, because there is that variance as well.
As we were reviewing publicly available information, we also saw some different types of discrepancies emerging. The first type of discrepancy is between the ways that data is categorized. So as this is saying, licensed slots versus contracted slots, because some programs just have the state license, whereas others have contracts with the counties that they work with, versus the actual capacity, meaning how many slots are physically available, like how many units actually exist and can have youth placed in them, and then vacancies, how many slots are currently occupied or not occupied, and there were some differences between how these might be reported publicly versus by individual providers, as you could see on the slide. And secondly, we found over time, sometimes we'd see, for example, reductions in what a public source was reporting was actually available, but that didn't reflect a real-time decrease or reduction in slots, but rather corrections in data errors that had been present in the reported set for some time.
So what we did find is there is a wide variance in which counties actually only have a state license, which is very broad, and which ones, as I mentioned, like San Diego or LA, have a separate contract and what their contracting process is in order to provide services in their county. So for example, the license-only counties can serve people within 2 hours of where they live, and some of them said, actually, we will serve anybody from anywhere. And then other counties where it's really allotted by slots, and so in LA, there are 8 service provider areas, and some providers were given slots specifically for service provider areas and needed to hold those slots for those specific youth that live in those areas, which did create vacancies, which we will be talking about. Also conflicting messages, again, regarding, are these youth from short-term residentials moving down, or are they youth who have really highly independent skills, just needing one leg up? We also noticed that there were some increases and decreases that didn't seem necessarily related to data about how many youth might be coming in or leaving, but maybe it was related to whether they got a home key grant or some other experience for how they and why they could open. And so one of the big openings we saw in the period that we studied, which was a year, was Riverside had a huge explosion of a number of providers. So they went from 4 to, the provider said there were 15, but what we saw in CDSS was 9, but still that's a huge growth. And one provider themselves said they went from 8 slots to 30. So that was one particular county that just had a huge growth.
We also wanted to present you with a county-to-county comparison, Los Angeles, San Bernardino, and a Central California county with the name removed to kind of protect the anonymity of the providers in this smaller county. But this is to give you an idea of what these different types of information that I mentioned earlier could look like, seeing the licensed slots versus the actual slots versus the occupied slots, which we call census, and then the vacancy rate of each county's THPP NMD programs. And then on the very left, we have the number of 16 to 17-year-olds in each county that would be likely to exit foster care and enter extended foster care in the next few years. And you can see that there's a lot of variation between these counties, ranging from under 10% in LA to 25% in the Central California county. And we found from talking to providers that some of this discrepancy could be due, or some of the vacancy in general can be due to a disconnect between the number of slots that the providers are having to maintain available versus the number of referrals that they're actually receiving. And we believe that some ways to help address this disconnect could be sort of, as is shown with the data underneath the table, paying attention to what the need actually is, how many youth are going to be entering in the next few years or currently need this service versus how many slots are available. And secondly, as this quote is talking about from Santa Cruz, where a provider was telling us that they had beautiful homes available, but were not receiving enough referrals from in-county, promoting more cross-county collaboration to allow youth to make that decision. Maybe if there are slots available, maybe I want to take advantage of these vacancies in these beautiful homes in Santa Cruz and make this choice for myself, that I should be able to move from my county to where I can get the support and the housing that I need, even if that's not the county that I originally lived in.
So a little bit more about calculating need. Overall in California, foster care has really dropped. So over the last 10 years, from 50,000 to 30,000. But what we did want to note is, even if you look at LA, the number maybe looks static, but the percentage of those youth that are 18 to 20 is actually increasing. And over the last year, entering foster care in California, we're looking at youth re-entering, so 18 to 20. That was a huge jump from 53% from 22 to 23, and in LA specifically, 74% jump from 22 to 23. So over to some of our recommendations. One is that vacancies really increase costs. So whether you're thinking about whether you own a property and you're waiting 2 to 4 years to get a contract in LA, that's very costly for our providers to have an open house that can house young people that are just staying empty, or you're renting a property and a youth is moving out. And if you can't move a youth right into it directly, if you lose that lease, you're going to end up paying more because the landlord's going to jump the price of that lease. So what we really want to talk about, how can we manage the flow of exits and entrances to reduce vacancies, as well as maybe streamline the process of contracting so that providers aren't having empty homes while there's youth living in RVs or on the street or not having a place to live, to be able to streamline that faster. So the first recommendation is really pre-contracting the process timeline to maybe increase that to be closer to the licensing counties so that it would be faster to get these youth into these available homes. In one case, the contract required the DCFS social worker to look at the place before the youth moved in, where our recommendation is maybe the youth could look at it first so that they could move in faster, because that provider paid a whole month's rent waiting for the time that an overworked social worker had the time to go and see it, which was very expensive for the provider. Also, some providers are told to keep the space for a pregnant and parenting youth, which is great, that's needed, but in this case, the provider had 6 months where they were also paying for the other room because they weren't getting the space filled, and they were getting 20 calls a day from other youth that weren't pregnant and parenting, and they could have used that spot for someone else, and that was very costly for them as well. So we want to have some flexibility, as Mirabel mentioned, and then also look at the projected data and either allow youth to have usable data to look at what options there are, or to have a better flow of referrals.
Okay, Another theme that we saw emerging was the need for a considered balance between independence and support with THPP NMD programs. So our findings, first, we noted a lot of county-level variation in intended service group, as Selena mentioned earlier, with counties like LA County trying to serve youth with higher needs versus counties like San Diego attempting to serve youth who already have a really high level of productivity and independence. Secondly, we heard overall from providers throughout different ways of our survey that they were seeing increasing levels of acuity, mental health, and substance use needs from the youth that they were serving on the term of our survey. And our recommendations related to this finding are firstly to prevent this sort of cliff drop from occurring at exit from THPP NMD programs, which would be when a youth exits a program to full independence without having gained the necessary skills that they need for success with this full independence. And to help address this, we believe that exploring allowing gradual contributions to rent, utilities, damages, caring for emotional support animals, whatever the situation is for an individual youth, can help prepare youth for real-world success, although allowing this gradual increase in responsibility is not the status quo of what's allowed in all counties currently. And in doing this, we understand the need to balance empathy and trauma responsiveness with recognition of healing and independence. Secondly, we recommend having increased sharing of data and resources for self-determination, kind of as I was talking about earlier, for youth to be able to make these decisions of what is the right place for me to live, what options do I have, what's actually available for me. They need to know what is really available. And finally, leveraging the unique strengths of providers rather than chasing uniformity among programs.
Yeah, just on that, we just know that some providers are meant in their mission and their resources to serve higher acuity, and some others have lots of properties and lots of landlord relationships. So let's not make them all the same, but actually look at what providers can do and what their resources are. So finally, some bright spots. So San Diego, despite their 40 hours, do have some flexible funding that others don't have. They have 3 to 6 months where they can help have extra resources to deal with substance use, or have someone's car broke down and they need some extra support to get to work. They have that. LA also added peer partners very recently in the last 90 days. And then the big one that we loved was Orange County actually has a meeting weekly where they can filter youth into these different levels of service. And they meet with all providers at once every single week. And we were able to see that last week. Actually, one of the agencies has both scattered site, which is the individual apartments, as well as a dorm style, where they describe it like a dorm, where if someone isn't quite independent, they try and stay there 9 months to gain a little bit more support on that balancing of independence and support to get ready for scattered site. And they do this, so we expect that maybe we could do some more county-to-county collaboration and community of practice so that we can learn some of these bright spots from each other. Thank you.
And now we'll hear on housing choice vouchers from Brenda, representing the UCLA Pritzker Center Research Fellow.
Good morning, everybody. As Ivy said, my name is Brenda Tully. I am a researcher with the UCLA Pritzker Center, and we are happy to be here today to present our study on the foster youth to independence housing choice vouchers. My research team was not able to make it today. 2 of them are on vacation, which is great. Carmen and Lucero Noyola, Abby Rubsova, Isabella Reyna, and Todd Frankie. So the UCLA Pritzker Center for Strengthening Children and Families unites a multidisciplinary network across campus and across LA to identify prevention strategies and that safely reduce the need for foster care while supporting an equitable reform in the foster system. So we want to provide a little bit of background on the vouchers. So the Foster Youth to Independence Housing Choice Vouchers are available to support young people aging out of the foster system with access to affordable housing. This is done through a relationship between the U.S. Department of Housing and Urban Development and local, so the money comes from the federal government, but it's administered locally through local public housing authorities in combination with public child welfare agencies. So in LA, that would be DCFS. And this housing choice vouchers are also referred to as Section 8, just for your reference. So the vouchers provide housing assistance to young people. A young person with a voucher would pay 30 to 40% of their income toward their rent. Their rent. The voucher serves young people between the ages of 18 and 24, and young people have to have been in foster care after the age of 16 to be eligible for a voucher. The voucher can be used for up to 3 years. If a young person participates in additional services through the Family Self-Sufficiency Programming, they can get an additional 2 years use of the voucher, so a total of 5 years. The U.S. Department of Housing and Urban Development offers both competitive vouchers, and that means that the public child welfare agencies and the housing authorities actually make an application to HUD for vouchers when HUD puts out the notice that vouchers are available. And HUD also provides on-demand vouchers, which means that when young people show up to a housing authority or the DCFS, they could theoretically make a request for vouchers for those youth who need them, above and beyond the allocation they got through the competitive application process. Depending on the size of the housing authority, up to 50 vouchers can be requested in addition per year. So in LA, for example, if the county housing authority and the city housing authority were to make use of these vouchers, that would be 100 extra vouchers here in LA for young people. So unfortunately, voucher utilization is low. We think that might be partially due to complicated application processes or potentially discrimination against people who have vouchers, despite the fact that many locations, including LA, have source of income protections, meaning that whatever income you have counts as income and a voucher would count as income. We do still see discrimination against people with vouchers. And then secondly would be racial discrimination. Studies pretty consistently show that Black, Latinx, and Asian renters experience obstacles that are racially motivated to securing rental units. Additionally, the FYI vouchers are underutilized in the city and county of LA. The great news is that 2 housing authorities, the County Housing Authority as well as the City of Pomona, already participate in the program through the competitive process. Also really good news, Culver City is coming on board, as is the Housing Authority of the City of Los Angeles. And I want to just give a shout out to Kate Teague, who is here from CYC, for her advocacy. And there are other folks, Dexter O'Connell from Safe Place for Youth, doing a lot of advocacy around this. And so there are actually a number of other smaller housing authorities coming along. This was great. The downside is that none of the housing authorities have requested on-demand vouchers. It seems that capacity in the housing authorities and maybe at DCFS might be limiting this process, and also perhaps some lack of knowledge about some changes in the rules related to accessing these vouchers. Okay, so our study is set up to understand what are the barriers and facilitators to getting and using a housing choice voucher through the FYI program here in LA. We are in the process of talking with young adults, with property owners and managers, and also with case managers to understand what's happening, what's working well, and what's not. Our study is in motion still, and so the findings that I'm presenting today are where we're at right now. Another aim of our study is to explore how young people's identities or aspects of their identities may be impacting their experience with these vouchers, either accessing the voucher or accessing units, apartments to rent with the voucher. We don't have findings on this yet because that data is still being analyzed. We're doing, like I said earlier, a case study of LA. We're using semi-structured interviews and demographic surveys with our participants. And as I said, data collection and analysis are ongoing. So who have we talked with so far? We're talking with young adults, so far between the ages of 21 and 27. This says 25, but we've done interviews this week. And so we are between 21 and 27 years old. We have spoken mostly with young women, a couple genderqueer young people, and this week we also interviewed quite a number of young men. We are talking with a group of young people sort of across the sexual orientation spectrum, which is good. And then primarily Latinx young people, but a diverse group of young people as well. For case managers, we again have spoken mostly with women, mostly with folks who identify as straight, and mostly Latinx case managers, although a little diversity is there. A quarter of our sample of case managers have related lived experience to what the young people are going through. So they've experienced the foster system, homelessness, shelter stays, and potentially have experienced subsidized housing as well. And then our case manager sample has just under 4 years experience working with young adults in the foster system, helping young adults get housed, and then also with property managers, owners, et cetera. Our property owner group, this has been an interesting group to try to get our foot in the door with. We have interviewed 2 people so far, so this is like our push right now is to really get that number up. So these are the description of those folks. The 2 people we spoke with have a lot of rental units, between 11 and more than 20. They both had more than 20 years experience renting units to people, and they currently neither participates in a housing choice voucher program. One of them did in the past, and the other one has since August been trying to work with the county to get a 3-bedroom house rented to a tenant who the landlord had a very good relationship with, but due to a lot of hiccups at the county, that has not happened yet. So the process is pretty onerous for him. He owns that property free and clear, and that's why he's starting with that property, because he has the bandwidth to kind of pay the taxes and things with the resources he has, and he's not dependent on the voucher for paying his mortgage. So our preliminary findings suggest barriers and facilitators to uptake and maintenance of the housing choice vouchers here in LA at 3 different levels: the systems level, the service access level, and interpersonally. So first we have the barriers. In this space, fewer vouchers are available than are needed, and the vouchers are geographically limited. So here we have case managers talking with young people to explain the vouchers to them. And what they shared is that they really kind of couch this resource, right? So they're saying, quote, "I tell them not everyone gets chosen. It's very, very limited." So the voucher, the FYI voucher, is seen as like plan D, E, or F, not plan A, B, or C. It's extremely limited. The next thing is that delays and uncertainty abound in the process as well. So we spoke with a young man who shared that he learned he didn't get the voucher on the last round of when they were available. So he asked, when will applications open again? So he could, make a plan for his own housing and prepare. And a staff member at DCFS shared, quote, "Honestly, we don't know when we will receive the vouchers," end quote. So this young man was left kind of mystified about kind of how to progress. He started to not see this as a resource for himself. Similarly, there have been a number of instances where case managers have shared that they have worked with a young person in a transitional housing program, like Selena and Mirabel were talking about. The young person was aging out, and they had applied for the voucher but hadn't heard anything back, and they needed to make a plan. They had to leave the transitional program and go elsewhere. So they did, and then this case manager shared, she made a phone call to the young person to say, "Hey, DCFS wants to interview you for the voucher." And the young woman shared, quote, the case manager shared at this point, the young woman already had an apartment with her partner, so she was upset. The young person had signed a lease with her partner, and so the FYI voucher was coming at a time that didn't match up with kind of her availability. And she was living with her partner, and if that continued to go well, she intended to continue to do that, and she wasn't sure if she could do that with a voucher. And then finally, in terms of systems barriers, there's very limited work happening with property owners to try to engage them in the voucher process. In terms of the service access barriers, we see young people, we see young people also struggling to identify housing to live in. And so one young woman shared of her sister, of her brother, quote, "Because if my brother's received 3 extensions for the voucher on the timeline to get, to use it, he still doesn't have housing. How is he not being swarmed with support? Like, we need to get you leased up. What do you need?" So she was really struggling to understand, here he was with the voucher, he was searching for units. He had trouble locating apartments in the jurisdiction where the voucher was valid, and he was not getting the support he needed, according to his sister. His sister had applied twice for the voucher, passed it up the first time, very much regretted it, applied again later, and then she turned 25, so she was too old to get it again. And then in terms of facilitators, so on the system side, a couple of really good things are happening with DCFS. So DCFS is connected with service providers, and those service providers are getting notice when vouchers are available, which triggers their work with young people to start the application process. So that's good. Additionally, the DCFS application, which is the first part of the application process, is very straightforward to complete. So those are really good things. And then in terms of support is the primary thing that is moving young people through this process. Both support on the service provider side. This young person shared that the housing authority needed really specific paperwork that I didn't know. When I thought I was going to have to do this alone, I just kind of lost motivation. Then she shared, when I was feeling really overwhelmed about it, my caseworker just made it seem like it wasn't a big deal. So the caseworker's role in helping this young woman move through the 45-page application required by the housing authority was instrumental, and that was fantastic. So with that, I'm gonna just move ahead. Family support was also really helpful as well. So both of these young women ended up getting housed with their voucher, which is great. So we have some I'm gonna move through these due to time. Okay, we have some recommendations. So we recommend developing ongoing training and support for case managers, housing navigators, and other people working with young people who will age out of the foster system. To Ethan's study, young people need those life skills. They need tangible skills, and our system is paid to help them develop them, and so we need to make sure our staff are able to do that. And additionally, support with young people who are moving through the FYI voucher process to deal with the uncertainty and all of that. Next, build and expand the Housing Navigation and Maintenance Program. This is a program designed to support both young people moving through the process and also develop those pipelines with property owners. We'd like to see increased capacity at the public housing authorities in terms of increased staffing as needed and increased knowledge of this population of young people to support them. And additionally, increased transparency and communication across the system so that young people and their case managers know what's happening and roughly when to expect things to happen. And then finally, with enhanced system functioning and service access for young people, we really recommend accessing those on-demand vouchers. Thank you very much, and take questions.
All right, panelists, thank you so much for sharing this incredible work on accessing services today. We have time for questions, so if you would like to pose one to one of our panelists, Andy will walk around and hand you a mic. Andy's getting her steps in.
Thank you all for your presentations. It was very informative. I heard a lot of different conversations about resources and the discrepancies in which those become available. And one particular interest was the transition, the TILPs. And I'm thinking, I hope that this ultimately will help service providers be better equipped. Like, we understand that they're humans too, and they may be limited in the understanding of resources that are available. So it got me thinking, like, how can we effectively develop digital resource hubs for foster youth, ensuring easy access to available resources, and what challenges must be addressed to make this effective?
No, I think that's really questions for you. This is about.
You said TILPs, but did you mean THP NMDs?
So in general, the resources that are available. So I was thinking, like, in the development plans of TILPs, what should follow is the dissemination of those resources, but oftentimes service providers may not know what resources are available. And so what I was thinking innovatively is, like, potentially having a collective hub of resources that are, it could be tabbed at county levels. And the service provider can take that TILP back and input that information, and it will generate a list of resources that they can then.
Yeah, that's come up a lot, and I think that in our field, there have been lots of apps, lots of resources, and they've never been that useful. Many youth have said that they haven't always been updated to the point that they were useful, which was why I also thought that actually from a practical standpoint, Orange County's perspective of meeting people weekly and knowing exactly what was available was actually more effective, because they were able to talk with people who knew the youth and be able to actually look at what was immediately available, because the upkeep of a lot of apps have not actually been as successful as we would hope. Hopefully we could get better at that. That would be an aspirational goal. But I think in the meantime, having these meetings where the social workers and the providers are meeting together and are able to talk about those resources has been really minimizing vacancies and actually helping youth to get to where they need to be faster. And I also asked them, because our recommendation is, could they move from county to county? And they said they would pay for it. So I don't know if every county is willing to pay for it, but Orange County said they were willing to pay for it. So those are some of the county to county things that we could discuss that I think would be practically useful from that perspective. That helps.
Hi, and Professor Ethan, also a TILP question. I was wondering if you were thinking about expanding out to look at how TILPs and CFTs, or child and family team meetings, are playing together, and if that's a potential area that you're going to be following up on.
Yeah, absolutely. Again, we're just about to get into this the field now. We are just learning about the relationships and how these things are formulated, and we might need to get into these meetings at the same time. We may want to review some of the TILPs developed. Now it's kind of on paper nowadays, but it can be digitalized and it could be used in very different ways. At the same time, who's invited? The multiple laws actually ensures the youth opportunity to bring two people that can advocate on behalf of them to these meetings, but whether those are really practiced, and what are the other settings or other mechanisms that they can engage and meaningfully influence their service experience. Yeah, definitely.
I have another question for Dr. Park. It was pretty logical to me that the more TILPs that you had, the more services that you accessed. Did you look at how, from a county-to-county standpoint, they were measuring the percentage of TILPs to cases and how that was evaluated by the individual counties? Because again, that stat of the more TILPs that you have, the more services that they're accessing. I was just curious, again, if you looked at that as to, again, how that was being measured and reported at the county level for the cases and the caseworkers themselves.
As someone who's using these data, not producing these data, it's hard to tell that, hard to answer that question. But at the same time, we saw significant variations in the average number of TILPs developed per youth. As we saw from the result, showing that in some counties, the average youth developed up to 2 TILPs, but other counties, there's no evidence of having a documented TILP developed. There is certainly variation, and I'm not quite sure whether counties are tracking that information. And yeah, that's really the questions for the state and county administrators at this point. But yeah, sorry for not giving you a straight answer for that.
Hi, everyone. I actually have a question for Dr. Tully, and I'm kind of interested in the providers bit of it, and I know you all have only been able to talk to 2 people, but I'm wondering how is it being marketed, this opportunity? Because I know housing vouchers come with a lot of stigma, but I do think housing vouchers for foster youth is a particular niche that some folks probably, if they heard about, would want to do just ethically, like the idea of providing housing. I could see, maybe for good or bad reasons, some landlords being interested of maybe the public press of being able to say they do this. So is anyone marketing it that way?
That's a great question, Dr. McCall. I am, so I watched the video that LACDA has online that is geared toward property owners and trying to, elicit interest and provide some information about the process. And typically, in general, for Section 8 housing choice vouchers, we hear a lot in the news about differentiation of the different populations who get Section 8 vouchers. There's a lot out there about veterans. In particular, that's been pretty successful. There's a lot of information out there about families, et cetera. So what happens on the property owner's side, they don't know what voucher they're getting. Someone shows up to, look at an apartment or calls to, ask about it. They go to see it. They don't know what kind of voucher that person has, unless the person shares what kind. And so they don't necessarily know, which is why I think the outreach is really important. And that could build the bridge between general, I don't know about Section 8, or I don't know what kind of support people might have, to young people leaving the foster system. And some education around who this group of young people are. I think still there's stigma around folks being in the system because of troubled behavior, and stigma around young people in the system and why they're there. And I think we could do a lot to kind of continue to break that down. The 2 owners we spoke with were like, listen, yes, I want people to pay their rent, but I want good neighbors. That's the most important thing, is being a good neighbor, because then I know that they're not going to cause problems, with other people, and they're not going to make it difficult for my other tenants to live there. So that was, again, 2 people so far. But yeah, I think there's a lot of work that needs to be done there.
I also wanted to say that from the provider perspective, we had many providers, while they were waiting for their THPP NMD contracts, were interested in providing vouchers, and their fear was, okay, we have this empty spot, but there was no place to actually advertise, we are open to taking foster youth in our slots. And again, that fear of vacancies was there, and they ended up going to community colleges because community colleges were willing to fill those slots. And so I think we want to talk about that too, the management, and again, Orange County being a bright spot, they went from 4 vouchers to 108 in 1 year because the utilization ends up allowing them to have more. And so because they were communicating so strongly and knowing what youth were coming up and planning months in advance, they're able to really maximize their utilization of vouchers as well.
Just a question, what's the utilization rate in LA County?
Yeah, I want to say it was like, as of November of last year, it was about 45%.
45% finding housing within 6 months?
Yes,
Wow. That's
yeah.
bad. So it is a both and. I mean, I see it
It is.
as being a problem of there being a choke. There's not enough, so you've got Kate and Dexter running around doing really amazing work. I mean, thanks for calling that out, because I think that's the best work happening in this space right now. But it's also just a matter of getting over the administrative hump to do this stuff. And you know, there was, of course, the March guidance of last year, which did away with a lot of the more onerous steps to the FYI process, including allowing all these on-demand vouchers. Will your research also be talking to the case managers on the housing authorities to understand why they're not prioritizing this? You know, we understand they're busy and stuff, but they're on demand. They're there. So yeah, just wondering if you're gonna look at that as well.
Yeah, so in the prep to do the interviews with the three groups that we're interviewing, we spoke with folks at public housing authorities, at DCFS, and at the youth coordinated entry system. And so I can say through those conversations, folks overall had a sense that at the public housing authorities, they just don't have the staffing capacity to process additional vouchers. And the way that they're currently processing the on-demand or the competitive vouchers is they'll get 60 vouchers and they'll release 10, try to move those 10 young people through their 45-page application and into a voucher and starting to look for units, and then do another 10 and kind of move like that to kind of manage the pacing of it. So the linkage between having a voucher and actually being able to use it is, I think, one of the problems. The linkage between getting through the application process, there's that, and then once they have a voucher, using it, it needs support. It needs a lot of support.
Hi, I'm just curious if there's been a deeper dive in regards to the professionals that are working with our transitional age youth. I know that in the beginning, many years ago, we kind of developed the transitional age specialty of serving AB12 youth, and then I've heard, oh, the numbers have decreased, therefore we're moving to a generalist model in certain counties, and I think that that's problematic. So I'm wondering how deep you're looking at that. The second question I have is, as it relates to the transition of being in foster care, in a foster home, and then transitioning to a journey of independence. And from my experience, there's been a lot of transition of the foster home transitioning to a SILP. And so then that impacts our teenager, the younger youth. And so we're just moving the pipeline negatively to a different space. And so I'm wondering if we're looking at that as well.
Hi, Julissa. Good to see you. I would say that there's more work to be done, clearly, on some of that. But yeah, that pathway is something that we really need to look at. There were some providers in our last wave of our survey that were saying that what is good actually is looking at some youth staying where they are in an AB12 in their foster home, where a lot of times they were saying they were going directly to, oh, the youth want to leave, let's just go straight to SILP. That they're asking more questions and really just saying, are you willing to stay, support this youth longer in this home? And so it was good to see in that last wave that there was a little bit more of that, because we do need to look at capacity. And if someone is stable where they are, maybe work through, hey, maybe the relationship will change. You're not so much the parent, but you're going to be a little bit more like a mentor or a guide through independence. And those are the conversations that would be great to have, I think.
Yeah, I kind of want to follow that up, and anybody could answer this who wants to weigh in on it. I see a couple of themes here. One being the engagement of the county social workers who are supposed to meet once a month with NMDs, and our data suggests that's pretty much how often they meet with them. It's just fascinating how there's not much variation from that. With a population that has all these special needs, they move around. It's a huge percentage of young people, by the way, who are living in a county other than where their social worker operates. And Ethan didn't say this, but we actually have some evidence already that to the extent that there was specialization in casework practice back in 2015, things are better. You know, the young people get more services, some of their outcomes are better. And then to connect it to housing, we have massive housing programs in this that you know, THP is one of them. FYI, I think the problem is that it's really kind of like a rounding error. You know, and so if you're, put it from the perspective from case management, expecting case managers, particularly if they're not specialized, their caseload's got a bunch of little kids, to know anything about the FYF program. It just seems kind of, on the face of it, to make no sense. We spend more on THP than, many times more in this state than on FYI. And then SILP is it's a housing subsidy, right? So I guess I'm wondering, can we really make this work, particularly given that we use programs like THP? THP is, wow, it ought to be, and actually the law suggests it should be for young people who have greater needs, not those who are like able to make it on their own, don't need help. It costs a lot more, you're supposed to have a lot of bells and whistles there. But as long as our workforce isn't specialized, has caseloads that are large, there's nothing between that little bit of case management and whether you're lucky enough or your workers enough to get you in a THP. So I'm wondering if you think we can solve this problem without actually doing serious work on the workforce side and really thinking at the state level of how we would, you know, empower case managers to have the expertise in transition age youth development, et cetera, transition from the child system to the adult system. Can we make it work without doing that? I guess it's a question I would ask all of you. You see a way out of it, you know, without having case managers who actually have, maybe you contract out those case managers, but somebody, a young person, can meet with more than once a month who actually knows what's going on for policy and practice around transition age youth.
Yeah, I don't think we can. I mean, I think, you know, we don't have good data on independent living skills programs and the efficacy of them, teaching skills and skills that young people can use. And so that worker is so important in providing support. And the ways that I think we need to get super creative about how we're trying to engage young people. You know, there's the once a month meeting. What that looks like probably varies incredibly over worker by worker. And I think that one of the things that I became aware of during this project is training that the intensive case management staff here in the county get through the Department of Health. It provides them with a toolkit that is very extensive. Motivational interviewing, harm reduction, housing, a whole suite around housing, a whole suite around financial literacy, like just a whole suite of skills. And I wonder if that might be a model that could be helpful. I don't know that I don't know the research on that. And that exists not just for young adults, it's kind of, you know, for anyone who qualifies. So I think we have to figure out a way to help young people make that transition with the skills that they need and the support that's meaningful to them.
Notwithstanding Mark's statement that it's a rounding error.
I'd like to hear from them.
Oh, sorry.
I mean, I think mentioning the workforce problem is huge. As a social worker myself, I started with, hey, what are all the resources? What are the ones that are funded by HUD? What are the ones that are funded by child welfare? What are the ones that are funded by juvenile justice? And it was a map, and it was very complicated. And I thought, oh, well, if I create this thing, I can hand it to all the other social workers, and they're going to know. And then I was like, well, that's not really practical. They're always changing. I've got to cross out this one doesn't exist anymore, this one doesn't exist anymore. And that's how we ended up with Orange County being a good model, because if you months in advance or a year, 2 years in advance, you had a committee. You know, every Thursday morning they have this meeting, and every provider that offers every type of service along the continuum of high acuity to SILPs and vouchers is able to say, who do we have in front of us, and have that social worker present that youth, or even have the youth present at that and present all these options in real time. It seems to me one of the best examples so far, given that we have workforce issues. They're not going to know all the resources, and all the resources are always changing. That was just one of the examples that I think could potentially work, given that we're not going to solve the workforce issue immediately. That if everyone's meeting together, somebody knows the youth very intimately, or the youth themselves can hear, this is opening, these are the options. I do think that that's a good option. I asked them about their vacancy rates. They said, oh, we have a vacancy this weekend. Like, you know, it was a very high utilization rate with very low vacancies. So I think that's a good bright spot.
I think, I'm not sure we can talk about the under review analysis, but all right. Yes, I think in a way it's a kind of mixed story. You know, I mean, we did a separate analysis using cow youth sample, and because we were able to control for so many range of different characteristics of the youth in the analysis. And then we did that when ages for the youth were 17, 18, 19. This having like a greater proportion of the caseworkers being specialized was a significant factor, predictor of the youth developing TILP. But when it comes to the 2021, the effect fades out. It is more about the county child welfare department's collaboration, like the quality of collaboration and the breadth of collaboration they have with the other service system that really drove the development and the engagement of the youth in the TILP development. It was kind of a mixed bag. At the same time, in a separate study that we did with another cow youth population, we learned that proportion of the specialized caseworkers in county was somewhat associated with not engaging youth in the TILP development. It was quite a surprising finding, because we might speculate a little bit, but it's possible that these specialized caseworkers may have a really great understanding of the system and the understanding of the needs of the youth, and then they develop the TILP on behalf of youth without really consulting them. And counties with fewer caseworkers specialized in the working with TAY may be willing to listen to the youth, or willing to learn from their needs and wishes. So still, there's like a mixed findings, but I don't think it's a kind of one straightforward kind of answer, I guess. Like having more specialized workers is always good. I don't think that's the case. It is about the context, it is about the timing, and it's about the phases youth are going through.
All right, and we have time for one more question.
Thank you. And I appreciated the nuance of the answer to that question, because I'm just thinking there's an incredible amount of difference, like for example, between Imperial County and LA County and Shasta County, that you can't develop the same kind of solutions. And I think the answer to the engagement and the TILP question is probably equally nuanced. When you are seeing the relationships that allow for better engagement in the TILP process, you're gonna see better TILPs developed, you're gonna see more services. And so the data tells us one piece of it, but I think there's probably a whole nother story around like how that data come to be. But I do want to say I think the peer folks have an incredible amount of promise, because you're right, we're never going to get capacity with our caseworkers, but I think young people themselves, even some of our resource parents, being able to develop those relationships and go out and make matches is really powerful. My question, though, is, and I just want to say thank you for the data. I feel like we could actually, I have so many questions. We could spend the whole day on this panel alone. So thank you for sharing this with us. But my question is also, for this age group, the relationships that young people have with the adults in their life seem incredibly important. And we're talking about placement and where they live. But there's something else. For example, with SILPs, we know many young people, for example, want to go home to live with their biological family, and that may be represented in a SILP. Or, as Julissa pointed out, the continuation of the relationship with the resource parent. And so I'm wondering, does your data capture at all the relational element and how that's impacting outcomes, whether young people are in a setting where they're essentially being parented and supported and cared for as they're transitioning out? And so I have to say, in my opinion, this stage of life is sort of akin to toddler stage of life, when young people really need those supportive cheerleader adults who are going to help them problem solve and navigate.
All right. Before answer the question, I wrote a dissertation on the peer-based model in the substance use disorder treatment centers, and I believe that's a really powerful mechanism that many practitioners somewhat disregard or sometimes forget about, because it's very important mechanism, important approach to really bridge the trust and some sort of providing additional support and the security for that relationship that youth and caseworkers will build. Yeah. So I think what you're discussing is whether these relationships have certain meaning or a certain a protective factor. So actually, the Nate Ockpitch was my co-author here, and I and other team members wrote a paper on the enduring relationship. Yeah. So we tracked, we asked youth when they were 17, who are the more meaningful person, who are please name 8, 9 people who are meaningful to you. And then we asked that same question when they turned 21. And we learned that about half of the youth had at least one meaningful person, who were named in both waves. And then it turns out that having that at least one person have significant protective factor, as protecting role in terms of the preventing homelessness, being kicked out, or having the economic hardship. Right? There's so many different areas that these enduring relationship can protect these youth from falling into the cracks. So I think that's another really important area that we're not really engaging or studying more, but I really appreciate your question, and I hope there's more study on that. Yeah.
And that study is summarized at the on the TAY-Hub website.
Yes, it's on the website. And we are going to give everyone a round of applause. Sorry, Selena. We'll be back here at 10:30. I'm a stickler for time. 10:30. Restrooms are out there. Food, please enjoy. Get a packet if you haven't gotten one.
Oh, no, no worries.